Nadusha in Chicago, and you're watching my channel, Knowledge for Quality of Life. Friends, today's topic is on blood pressure. So before I get into the details, let me share my screen with you. What you see here is a pictorial presentation from Linus Pauling Institute of Oregon State University. Linus Pauling was a great scientist, and he was a Nobel laureate as well. He did numerous things. He was a biochemist, chemical engineer. He was a genius, in essence. And this institute is named after his legacy, uh, and they are doing phenomenal work in almost many areas of healthcare. So basically, high blood pressure affects 1 in 2 individuals, adults in US, that is 50%, 3 in 4 adults over age 65, which is 75%. And this is the demography. In Afro-American, it affects 55%, white 46%, Asians 40%, Hispanic 37%. And these are the conditions which we are concerned about most of the time when we talk about high blood pressure. The risk of stroke goes about 80%, 8 in 10. And heart attack is about 7 in 10, which is 7%. And heart failure is 7 in 10, which is about 70%. So all these related to high blood pressure. What is a blood pressure? Blood pressure is the force that is exerted against the arterial wall as the heart pumps the blood. So think heart being a motor, okay, and think of all the arterial network in our human body is like piping, okay. So heart is pumping, and it's the blood is being circulated through the arterial system to reach to the each and every part and every organ of our body so that it gets the oxygen. And if it remains active, it remains alive, and it remains functional. Okay. And if there is a blockage somewhere in the arterial system, guess what? It can back affect the motor as well, so it can affect the heart as well. So this is the pictorial system here. What is high blood pressure? So as the blood goes through the arteries, it exerts the pressure on the endothelial layer, right? And it naturally, in an ideal condition, this artery has some great flexibility. But over time, based on the lifestyle which we lead, the amount of things which we eat, the junk which we eat, the nutrients and minerals and vitamins which we deplete from our body's reserve over time, and we don't replenish, this arterial system gets rigid, and rigid system is gonna prone to break, right? We know that. So how we can keep this system in a flexible format for the rest of our life, and through the lifestyle. Now, I'm not saying by any means that people who are experiencing the condition of high blood pressure should seek the lifestyle modification right away, because it could be detrimental. You have to work with your doctor, because high blood pressure condition needs to be managed. It cannot be left alone unmanaged by the medical professional, because it can have a detrimental effect, not only from the stroke or heart attack perspective, but also many other conditions. So high blood pressure affects our health as blood flows with the exerting the pressure. It can leave tear scarring in the interior wall, interior lining. Weak spots can be created over time that can rupture with the atherosclerosis and plaque buildup. Because remember that if you are putting a water in your garden through a garden hose, and if you squish that pinch that hose from the tip, and the water just squirts out, right? So what's happening, that whatever the water is coming, whatever the discharge is coming, at one point It has to come out. Now, discharge is nothing but the cross-sectional area of the pipe and the velocity which is it's flowing through. In this case, the cross-sectional area of the artery and the velocity of the blood, which is with which it's flowing. So if there is a blockage somewhere, if there is a rigidity somewhere, and then flow is not there, the cross-sectional area is not there, guess what? The blood is going to squirt through, and then that can exert the pressure. So it means that over time, what happens that as we age, our arteries gets rigid. So if you get your CIMT test done for carotid Doppler, it's called carotid intima median thickness, they can actually tell you what is your actual biological age of the artery. Okay, your physiological age could be different. Your biological age could be different. Your arteries can be 10 years older than your actual age, depending on the lifestyle that we are leading. Okay, and reverse is true. As we age, some people can have 70 years of age, but their arteries are as good as 50-year-old, depending on the lifestyle that they are leading. So these weak spots that can rupture easily, blood clot formation, because as the consequences of the arteries rupturing, clot is going to form it, and then try to plug it. That's a natural phenomena, and that can create a clot formation. Increased workload on the heart, as I said, if there's a blockage somewhere, it can have effect on the motor. As here in this case, our heart is a motor. Plaque buildup also over time. Now, systolic pressure is the higher number and diastolic is a lower number. Now, systolic is pressure exerted as the heart contracts, because heart is contracting and expanding, and in between there's a rest condition for a bit, and between these two mechanisms, right? So normal being 120 millimeter of mercury, and the lower bound is 80. Now this number is coming from the J-curve study. If you can Google it, that J-curve for high blood pressure versus mortality or risk, then you will see that these numbers falls into that range. They have collected many numerous data over mega studies, and then they came up with this number. At risk, 120 to 129, and less than 80, and then stage 1 is 130 to 39, and 80 to 89 stage 1, and then stage 2 is 140 and above, or the lower number is 90 and above. That's stage 2. Now somebody may say that at 145 or 150 I'm okay, I'm normal. Is that if let's say if I am 145 and 150 and I feel normal, can I let it go? Personally, I think that needs to be addressed by a medical professional, because what happened, it may be okay I'm not getting any headache or anything, but remember that any excess pressure which is being exerted on the arterial system, it can have a detrimental effect in the long run, because it may creep over time. Okay, it may leave some tears and scarring in the arteries. Okay, so in the long run, it may not be okay. So you have to work with your doctor and address it properly, and do certain things to the best of your ability as a lifestyle modification. Revisit your lifestyle. See what you are eating. See how you are eating, and how frequently you are eating. And that takes us to the next level. And healthy eating, as we have been talking about all these time, use extra virgin olive oil. Do not use seed oils. Those omega-6 oils are bad for our health. They are the culprit of many numerous things. Eat lots of fruits and vegetables. They say about 8 to 9 servings of fruits and vegetables. Be mindful of picking the fruits, low glycemic load fruits, if you have an issue of insulin resistance or high triglyceride. Again, same with the grain. I have mentioned in the past, drink enough water. As we age, we tend to get less thirsty, and we forget sometimes to drink enough water. Because volume of blood, it depends on the amount of water intake which we take. right? So we have to make sure that, we don't gulp it down when we are thirsty. You take sip at a time so that, it reaches to the cellular level slowly. Otherwise, you are going to pee it out very quickly. It may not reach to the cellular level. So keep drinking sip by sip throughout the day. Eat healthy protein. Here, this is based on the studies done that weight reduction has the biggest impact on drop in systolic number. 5 to 20 millimeters of mercury, it's a big one. And then DASH diet. DASH diet, we will talk about it here. It's a dietary approach for stopping the hypertension. And it has effect of 8 to 14 range. And daily aerobic exercise, which we talked about. Remember that, I've been mentioning this thing that, individual my vlog is piece of the puzzle. You have to see the whole thing and try to apply each and everything and see the results over time. There is no such thing as shortcut and silver bullet. You will not find anything like this in my vlog that I'll say that, oh, you take this thing and it will clean your artery. Or if you take this thing, it will fix your blood pressure. No, it's a collective of small things over time. It's going to show you the results over time. Please remember, there is no such thing in life as shortcuts. Limit alcohol. Limit sodium. Of course, you have to take some sodium, but once you have a high blood pressure, you have to be mindful of your sodium intake. Because sodium is electrolyte. You cannot completely abolish sodium from your diet. And if you remove completely sodium, then eventually the lethargy is going to take over time, because you're going to lack in electrolytes in your system, and that's going to show on your complete metabolic panel as well. And you have to be mindful for that. So the first is here, dietary intervention can be of help to some extent, but always remember that, work with a partnership with your medical professional, and create a tag team so that, he knows or she knows what you are doing, and with the collaboration, you can be a health in charge of yourself. Increase your, few nutrients and minerals in your diet. When I say increase, means in a balanced form. You don't want to take a bolus dose. Make sure that, on the CMP range, you're checking all these things correctly, that you are in the range, you are in the adequate range. So my concern was that, when I stopped the, banana from my breakfast, my question was that, how I'm going to replenish that potassium, because potassium I need it for my body, because each and everything has a reserve in the system, but body is going to take those things from the reserves, and I need to replenish over time those reserves. Otherwise, my reserves are going to get negative, and eventually these health conditions are going to pop up in the future. So this is just like I gave example of, in the past that, you have a savings account, you keep withdrawing without depositing, your account is going to get negative one day. So these, the lifestyle, when we are talking about diet and lifestyle, means eating a balanced diet so that you get all the nutrients, all the vitamins, all the minerals to its optimum level, the way we eat. And I'm sure that, we are not 100% in that focus all the time, but do your best to the best of your ability, because that's the bottom line, actually. Because if you keep remaining on top of this, healthy lifestyle, keeping all the, because, we, like my mom used to say, sometimes I used to laugh that, my mom used to say that, how I'm going to get my stomach full if I don't eat this, and I don't eat this. I said, Mom, why do we eat? And she said that, well, we eat because we feel empty. We need to feel full. I said, well, how about if I get some stones and you wrap around on your tummy and you will feel full? And we used to joke around that, and finally at one point she realized that, she was getting a lot of medications because of her lifestyle, because, she was not in a mood, because she was from old school of thoughts that, she needs typical that chapati, or which we call Indians roti, and the salan, that, the curry, which we kill all the vegetables, nutrients, the way we cook. We mush everything, and then we used to eat. Yeah, of course, that tastes great, but what are we getting as a nutrient in our body? That's the question I need to ask to all of you. So we have to cook in a way that, the nutrients and minerals and vitamins remain intact without killing them. Okay. And then once she realized, she said that, okay, I will listen to you. You feed me whatever you eat, then I'll eat. And then it took about 5 to 7 years to see the results in her medication. And I remember 2.5 years before she passed away last year in April at the age of 99, she was not taking any blood pressure medication. So this thing is phenomenal, and be careful in increasing the mega doses of vitamins and nutrients, because you need to work with your doctor, because sometimes it can be detrimental to your health. Potassium, for instance, you cannot eat too much potassium, because if you have a kidney issue, then it can be detrimental. So work with your doctor, but make sure that you eat a balanced diet. Vitamin C is going to keep your interior lining very supple and in a pristine condition. Just like I take 1,000 milligram a day, and I think up to 2,000 is allowed by RDA. So 2-3 things I'm going to add here, which is not listed here. One is magnesium. Magnesium, which I have done vlogs and I've talked so many times. Magnesium has a relaxation effect of our arterial system, and it's going to be helpful in your lowering your hypertension, your blood pressure to some extent. The other thing is your vitamin K2. Vitamin K2 is vasodilation effect on your arteries, which I have done many vlogs, particularly natto. I've seen that, for the last 4 or 5 years, I've been eating natto because that sticky substance in that, natto, which is a Japanese dish, which we call a natto kinase. That's an enzyme, and it's a polyglutamic acid. It has a potential of keeping your blood thin, and if lesser your blood, less viscous, it means that, it can flow better. The uniformity can be better. The more viscous it has, viscosity the blood has, it's going to have some kind of a resistance to flow. So that's why sometimes, in the old school, still some doctors are saying that people who have heart conditions, to eat aspirin, which I'm not a big proponent of it, because, a few years ago, Harvard came with a study that, it damages the interior lining of one's artery over time. Remember that. So there's nothing comes closer to food. If you can eat in the food, then that's the best. Let me stop share here. So these are a few thoughts I wanted to, share with you. But remember that, don't try to fix, if you have a hypertension, don't try to fix it by yourself, by, alternative lifestyle, because this condition cannot be unmanaged, cannot be left unmanaged. It can be detrimental to one's health. So work with your doctor and create a plan. And if you are on medication and your lifestyle is not, it's not up to par, then, work with your doctor and, have a nutrition on your panel, nutritionist on your panel, and then work, all three of you, and slowly and gradually trim it down, that medication, and, by improving your lifestyle over time. I think it's doable to certain extents, which I think, I'm very mindful of it when I'm eating my, diet. I'm making sure that I get all the nutrients, all the vitamins, all the minerals to the best of my ability. And the rest is in nature's hand. Okay. Hopefully see you next week.